that was for me very heartbreaking to see that the community was becoming dilapidated in that way.
Yeah.
You know, increased use of meth. I can't believe it that meth is so accessible. Meth is a drug which can really cause a lot of
So
issues.
much harm.
From my experience and the norm, I feel they're scared of being judged in a way. Or, okay, it's being said that if like so if you actually come out of the cage, it's gonna you're gonna feel like you're losing your masculinity.
Sure.
I mean, your circumcisions right now, which are quite elective, maybe in the private space, are below the ages of 13. But I do think it is quite important that we actually do start talking about that, start talking about the aftercare.
Hello everybody and welcome to our podcast. Lebitso la ka ke nna Lefentse wa ga Masha and I am your host. We go by the name of Dlalisa Moyeni. Happy new month and welcome to Men's Health Month as well. And yeah, man, thank you so much for the comments, the subscriptions, the suggestions, guys, everything. We are out here to say we see you. And kilona lebaka le eleng gore we are here. We want to build a community with you. Re batla go tshwarisana ka matsogo gore re thuse go agisana a young boy child ku ka sia ka or ka sia gago, so that men can know that it's okay to cry. We want to build that safe space for your son, for my son, so that they can know that, you know, they do have a home, they have a place to run to. They have issues that they can tackle, that they want to tackle as well, but there's a place where they can be able to do that. And to unpack this further, today we are joined by the ever so beautiful Dr. Katlego, Selikane, as well as Mahlatse Seloma. And let me take this time to welcome them. Doctor, thank you so much for your time and welcome. You know, when you take your time out and you come, when you're invited and you come, for me it speaks volumes. It says you take me seriously. It says you see me, and I really appreciate that. Thank you so much. And how are you?
I am feeling great, but I also need to say thank you to you that I was invited for this conversation.
Sure.
It's very important for us, especially from the organization that I also represent, Get Ready. And as you said, it's Men's Health Month, but I think it's also important that it doesn't end here. The conversation doesn't end today, that
Sure.
it's not something that we only speak to men and about men.
Just
only,
in this month.
Yes,
Yeah.
only in this month. But as I said before, I'm really excited, and I'm also happy that Mathlatse is here. You know, it gives us a nice, a balanced view
Sure.
of talking, because I mean, I'm not a man, I'm not a boy.
Exactly. And that was the exact reason why we're here today with Mathlatse to say, let it come from the horse's mouth. Mathlatse, hello and welcome. How are you? Before we re-appeal into the taba.
Yeah, I'm doing good.
Sure.
Thank you.
Are you great?
Yeah, fantastic.
Yeah. Umunad.
Come on up. Come on up. Yeah,
All right, guys. So I think we can so much just get into it. You were just saying, Doc, to say harabanna and haratsibi, and it's good to have from a perspective ya motho wa monna or a young boy child who can say, but hey, emangnyana guys, o ka re la ilatla. I don't understand this. There are certain things that I don't understand about my body. How can you help? But before that, Doc, we just want to relate. We want to know hore Dr. Katlego ke mang. Dr. Katlego o goletse kae? Hore o fitle hore o be doctor o fitlile bjang mo?
Sure, very long story. So I'll try to cut it short. Kids wa Pitori, okay, so where Dlalisa Moyeni is from, right? I'm from Soshanguve actually, and then we lived all around Pretoria. I went to school at Pretoria High School for Girls. From there on, in actual fact, I thought I was going to become an actress and a playwright. Yeah, so
which makes a lot of sense.
So it was the plan initially
All
to
right.
become a doctor, and then somewhere down the line, I kind of found myself more in love with the arts. But anyway, I'm glad I found myself back at this place because I had made a promise to myself when I was 13. I went to a school, a very good school. I loved that school. It taught me so many values. And at that school, I was a prefect when I was in grade 7. And there was a boy I was responsible for who suddenly just passed on.
Oh no.
And when he passed on, I was so heartbroken by the death. And because of the symptoms that they described, I put 2 and 2 together, and I had decided that I would have this public health, initiative where I would become a neurosurgeon and teach Africans about brain tumors. So that was the plan, and then I fell in love with acting, whatever. So then I got deterred, and then my mom came in and she was like, "Chumi, okay." So somehow then I did, yes. So somehow then I did find myself back in medicine. Okay, I did a 4-year program. It's actually, the campus is in Mums. The UP campus for the 4-year program. It's actually in Mums.
Oh.
And then, I found myself in medicine, and 6 years later, I became a doctor. Then from there, I worked Mojubeke. I worked at Mathlatse Hospital for my internship, community service Kaira Kutembisa Hospital. And then I was unemployed for a few months. And luckily, they advertised the post at Giredi for young doctors when we still had our mobile health clinics. And I was appointed, and it has been me and Giredi ever since. So now I am the lead of Giredi, and we have a digital campaign focused on adolescents, so focused on Mathlatse. And that's why I say to you that it's very important that I'm here and I'm able to gain as much as I can gain from Mathlatse as well, and this conversation.
And tell us about the time when you were at Charlotte Mathlatse. How was that like? Because I also know you're passionate about young people as well, and obviously you meet a vast number of people, old and young. But what took your heart at the time? What did you see as a pointer in this area? So much more is needed to be done. What really broke your heart? I think that's the right way to ask
For the boy child?
Yeah, and at the time when you were working there.
So I wouldn't actually look at Charlotte Mathlatse, okay? I'd actually speak about my community service more, because that's where I had more of a senior role, right? Whereas at Charlotte Mathlatse I had more of an internship role, and a lot of things functioned quite well at Charlotte. But when I was then, I'm not saying everything was perfect, no, I'm definitely not saying that, but it was when I actually worked as a community service doctor, because that's when you get to see the needs of the community, right? That I saw that when I was working psychiatry specifically, that we had an increase of the male population in the psychiatric wards, okay? And a lot of it was substance use disorder. And that was, for me, very heartbreaking to see that the community was becoming dilapidated in that way. Increased use of meth. I can't believe it that meth is so accessible. Meth is a drug which can really cause a lot of issues.
Much harm.
It causes a lot of harm, and the future. You look at this young person, and when you speak to them, and it's very important that you don't focus on the cause of why they're there. You need to actually speak to them and see them. And when you actually do that, it's when they tell you the true reason why they found themselves there. Like, I'm not validated at home. Nobody hears me. Only my friends care about me, and then the friends are the ones that then expose them to this. And then you have to have that tough conversation of, does a friend really care about you if they're exposing you to drugs? And also some of them, they find themselves through in drugs because it's how it allows them to creatively express themselves. So they are making music. So they're very talented, and to see them trapped in this drug cage was heartbreaking. That for me was the worst to see. Speaking to them was very heartbreaking, because I could see that there was a boy child in all those men that I used to speak to, even the young that used to come, and we would get very young patients.
Boys,
where you would find that they just want to be seen, and they're navigating a world where they don't even know where to look for support and how to look for support and how to say, I need help.
Sure. And now that we're at Giredi, what is it that you are seeing more? Because that was when you were doing your community service. Are you still seeing, when you were doing community service versus now at Giredi, is it still the same issues regarding young boy children as well?
So let's speak about the mobile health clinic, right? with the mobile health clinic, because we then transitioned into this this communications campaign. When we were doing the mobile health clinics, we used to go into hard to reach areas, but in Gauteng, it's more your informal settlements, right, where there is a need for access to healthcare services, and we used to provide them for free. What was sad for me is that the men and the boys had to be really reached. They wouldn't always come through.
Yeah.
So we struggled with getting a lot of boys and men to understand that it's important to be proactive with your health. And it's even something that I saw as I was going in through clinical medicine from internship up until this point, where it's a thing of, you know, most of the time you see the boy child or the man when it's a little bit too late, or not too late, but when it's later than what it should be.
Sure.
You know, so that's something that used to kind of bother me. And we actually even had a segment on Giredi on YouTube just to speak about why are men not so proactive with their health. And is it a sign of do they really feel that it's a sign of weakness to go to the doctor and actually just, you know, start to talk about things before it becomes really bad, you know? So right now in the communications campaign, we are still growing our network and we're still growing our connection to young people. It is kind of difficult to get the boy to engage with us, but I think that we also need to do more. So we've actually started a campaign now called Mujita Monday Series, where we have a doctor, Dr. Lutando, who is very passionate about speaking to the men and speaking about soft qualities, you know, qualities that men don't feel are rewarding, which is empathy, vulnerability, and so forth. And I love the angle he chooses in how he shares about the importance of having these qualities of being kind, and that actually makes you strong, because when you do these things, you strengthen the community that you're in. That's a leader. If you're kind and empathetic, you're a leader.
Sure.
You know, he speaks about the importance of crying. So now we've actually now included a 17-year-old boy that's going to join the conversation so that it's not skewed. So it's not just like prescription, that we actually even get it from the sense of where the boy child is in the state right now in their teen lives. So yeah, we're praying for the best, and we are putting in a lot of effort to make sure that the boy child feels seen, heard, feels validated, and actually that empathy gap is met. Because that's actually what the theme is this year. I don't know if you know that. For men's health, it's about closing the empathy gap.
Nice.
So it's about the awareness, and it's about us being more proactive in dealing with young men.
I like that, Doc, and I'm glad that we have Mahlatse here today, who will then perhaps tell us the reason why, Mahlatse, it's a little bit hard for, you know,
For
not
men to
even that
open up.
doctor that you don't know, your mom at home.
Yeah.
Why would it be so hard for her to reach Mahlatse? And I'm not talking like this, I'm talking your emotions. Why would it be so hard for her not to know what Mahlatse is going through, you know? For you not to be able to just go to mom and say, Mama Witi, I'm feeling like this.
Yeah.
Why would it be so hard?
vulnerable. I mean, from my experience and the norm, I feel they're scared of being judged in a way. Or, okay, it's being said that if, like, so if you actually come out of the cage, it's gonna, like, you're gonna feel like you're losing your masculinity.
Sure.
You feel me? So, yeah, I think that's what they feel, most men. And as I feel like a mother talk also, it'd be better with a dad.
Okay.
I don't know.
Okay.
Because, yeah, you're gonna relate more with the dad in a way. So
it's not from a point in any way of lenyatso towards your mom. You just feel she doesn't understand.
Yeah, she wouldn't really relate to you, or like she doesn't have the capacity to like respond to what you're gonna tell her. Or she won't be able to like help you in a way that I think talking to your dad would help you.
Sure.
Yeah,
I
so,
hear you.
but yeah, most part of it, I just think men are prideful.
Okay.
Yeah, they're a hard cookie to crack. So I feel like as a mom, or you could also talk to them, or as a dad, you should try to like crack the cookie. You should keep knocking until the door opens.
It doesn't push you away though?
Doesn't it?
Push you away? Like that's always my fear, that, you know, then we'll ultimately lose you if I keep knocking. I just want to know that part.
Yeah, I don't feel like that. To me, it's gonna. I don't know. I don't think that would be true.
Okay.
Yeah.
And if you were to see a mobile clinic, it's there, get ready. And they're offering different services. What would they be? HIV and AIDS testing?
Yeah, but that was
TB?
before. We don't have the mobile clinics anymore. Yeah.
Okay. But those were some of the services that you would offer.
Yeah, so, and it was targeted towards the youth.
The youth,
So
particularly.
yeah, Mathlatse was definitely our target audience. So yes, we were looking at blood pressure, diabetes, and I know like young people think that you shouldn't be checking for those things, but we're looking at lifestyle diseases. So we're checking your BMI just to see, you know, where you're sitting with your weight and so forth. Should we have a conversation about the way you eat? And also we're looking at sexual reproductive health services, because that's something that's very important to you. So speaking about, you know, your condom use, how you're protecting yourself, and also giving you a check if there is signs of STI or anything like that.
Sure.
And also HIV. You are definitely correct in that.
All right. So if you were to see that type of a mobile clinic, would you willingly, without them having to come to you, come forward and say, hey, I just want to check. Yeah, do you get me? Would you do that?
Nah, I don't think I would do that actually.
Thank you for the honesty. Why wouldn't you?
I feel like a mobile I wouldn't, but a clinic, yeah, I would.
Okay.
Yeah. The thing with mobiles is that like
everyone sees
you. Everyone sees you, and worst part is the people that you know, because I mean it's in your community. So yeah, it's gonna be like you're gonna put up an image outing. Maybe you are part of, not to say it's a bad thing, but yeah, maybe you're not well or something. You know, you're not really. It's not something that you're willing to put up. Because if you go in there, it's gonna look like something is wrong. Right?
And actually, and he's correct in saying that. That was one of our findings, right? Because we also used to go to universities. It's that the idea is that it's not about being proactive. Because I mean, you could come into the mobile clinic just to talk to us. It doesn't mean that you're unwell.
So the idea.
Yeah, the idea.
Where are we in terms of our thinking?
So yes, so that was one of our limitations, that young people would feel, especially young men, would feel that I should only go there if I'm quite desperate and if I need to heal something, if I need to take care of something. But just to go, I'm not going in there. And it's just like, no, that was not the point of Giredi. Giredi, yes, we weren't there to treat. We're actually there to promote health and to promote vitality. That's why we say Giredi. I'm ready. I'm ready to take ownership of me. I'm ready to take ownership of my life. And if there's something that I could just implore to young people, but especially young men, because it's mostly young men that we find in very dire situations where it could have been prevented, because you have this idea, or it's assumed, sorry, let me not speak for you, but what we assume, what we can see is that there's this idea that, you know, I can't go to a clinic just to check myself. I have
something
to go.
has to happen.
But and most of the time it's when they can't live with the thing anymore, and that's when it's really bad. But when like Hesi Sosela like is very big and it's very obvious. Now
Doctor, we are back. We are in June month, and I think it's also prevalently known for the month for initiation, the time where boys go through their circumcision. Perhaps for others it can start a little bit earlier on, so maybe the month of May. But mostly we know that June is school holidays, and many of them might go to, it's the time for circumcision, they go to initiation schools. Is there any talks around this Kuki Ready in regards to that?
Actually, thanks for bringing that up. Right now, no, we don't have a conversation running talking about circumcision, but thanks for that. I think that is something definitely we can add to it. Because as you are saying, it is something that is quite prevalent. It's actually around this time, it's mostly your elective circumcisions rather. Your more of the cultural circumcisions are later in the year. So your young your circumcisions right now, which are quite elective, maybe in the private space, are below the ages of 13. But I do think it is quite important that we actually do start talking about that, start talking about the aftercare, what it feels like, you know, how do you then put yourself back into society? What does it mean to you? Because I know circumcision is actually quite a big deal in a man's life, right?
Yeah.
Especially because of the cultural differences, Mathlatse, right?
Yeah.
Because everybody's different. So I know some people do it medically, and for other cultures it's frowned down upon.
Yeah.
Whereas in other cultures, you know, you have to go to the to the bush, and it's a sacred moment, and it really binds them together, and they can't talk about their experiences, which also
secrets.
worries me a little bit. Not that there's anything wrong with that. I think it's beautiful for us to maintain our cultures, but I wonder, you know, if something has gone on that someone can't deal with, if they have an opportunity or a source of assistance. So I think it's good that you brought this up, because it would be a conversation that really needs to be had.
Sure. And I know that Mathlatse is he feels very strongly about it.
What is that?
Yeah, in terms of initiation, and we had a little bit of a chat when we were coming here this morning.
Yeah.
Perhaps you can share your sentiments on what you feel about initiation.
Well, just like you, I don't have a problem, you know, I'm not against it. But, you know, from me, I didn't go there. Like, I went to the hospital.
Yeah, because of your culture, yeah.
Yeah, also because I'm white. I'm kidding.
I was like, what?
What are you talking about?
Yeah, so basically, my brothers, like, at my house, there's like 6 kids, right? So I have 3 older brothers, a sister, me, and my little brother. So the older brothers all went there, and then they all smoking, they all, you know, drink alcohol, blah, blah, blah. Also, where they are in life right now is not where I envision myself being. So it's not just them. Also, I think a lot of people who went to the the traditional initiation, like, they're not just in the right state right now. Some are doing drugs. Even most of the people that, you know, recycle on the streets, most of them, I think, yeah, they went there. So for me, it created a picture that if you go there, like, that's how you're gonna be, right? Because a lot of them, like, there's peer pressure against that, like, yeah, like, on top. So I think after they come back, they control, like, they have that power, and stuff. That's why they end up also using drugs, because like they no longer respect the households or their parents. They no longer respect the time they have to come back at home at. So they end up doing things like they are being told right? Yeah, so for me it was deep, so I didn't go there. My little brother went though. Yeah. Yeah, but me personally, I didn't want to go because of that. Yeah, I don't just envision myself in that type of life that I see from, you know, the people that come from that place. Yeah.
All right. Can I ask him something?
Sure.
So when your little brother went, how did it make you feel? Because I feel like you're his protector, right?
Yeah. I mean, nothing really, but I was concerned about how he's gonna start acting towards me.
Oh yes, because now he's more of a man than you.
Yeah, he's a man right now. So yeah, that was my concern. But yeah, it seems he's listening to me even now. Yeah, he's respectful, but yeah, nothing is wrong, nothing has changed. But yeah, I did tell him, bro, look, that man thing, if it is go tabing, you know.
Yeah.
Yeah, umunna go tabing. So I'm still your brother, just as much as you went there. Like, you have your own wants and needs, right? and I respect your decision for you to go. Because I think it's not allowed for your little brother to go if the eldest, like he can go if I didn't go. I must approve of it first. Yeah, so I respected. Yeah, I respected his decision, and I was like, no, he can go. Cause yeah, if I didn't say he can,
Could have caused
yeah,
unnecessary
I was
issues
just
between you.
said nah, he can go, and I still not go there. So I respected his decision, and yeah, he must also respect mine, and then he must respect me. So yeah, nah, we're good.
Could you also say that, Lefentse, and I think this would be, sorry for taking over, but like, I really liked what he touched on with the fact that, you know, after they come back, they're told that they're men, and then it seems that they struggle with substance use, as you're saying, right?
Yeah.
I don't have the actual facts or the numbers. But, you know, substance use is not, and people don't understand this a lot of the time, it's actually a mental health issue.
Problem.
Yeah, it's not like somebody is choosing to continuously do that, right?
Yeah.
So my question in this space is that, is this a thing of like you are told you're a man, but you don't actually have all the tools to allow you to be a man in society,
Sure.
and then that makes you struggle, and because you see that your life is not panning out the way you think it should pan out. So maybe you think that, oh, okay, Pankapeste, this jacket,
Yeah.
you know, and then you
Before
find
Ibanako.
yeah, but then you find that you can't fill that jacket for whatever reason. You decide that you can't fill that jacket, and then that probably brings you a lot of emotions, and you probably feel that you can't measure up, and that makes you struggle with yourself. That makes you struggle with imposter syndrome. That makes you struggle with anxiety, and taking a drug makes you not think about that.
Of course.
Takes
It
off that
numbs
pressure.
all of
It numbs
that.
all of that thing.
Yeah.
So I just wonder if that's also a thing. So yeah, it'd be interesting to see that theory of change.
Yeah.
Yeah.
Okay, to speak on that, nah, I think, yeah, you're right, Horing, that being labeled as men, but they don't have the skills or the tools yet fully, you know. So obviously they're missing some things, so that's why they end up doing such things, you know. But then also I feel like our society also plays a role in like how the era is right now. So, because if you look at the environment, Kokasi, we have a lot of older men, like they're doing alcohol. It's being made a norm, and it's being like they make it like it's a right thing to do. There's nothing wrong with it. So even me growing up, I'm gonna grow up like knowing drinking alcohol, beer, like there's no problem with it. It's a norm, it's a habit, it's how we live. When it's part of my life.
Just touching on that, Mathlatse, Kukasi, do you have a mentor? Do you believe that there are enough mentors, Kukasi?
Nah, not really. Nah. Because thing is, being in the program at Dlalisa Vele, there's a difference. I could see the difference. Like ever since I've entered.
From the time you started out.
Yeah, like there's a huge gap. Because yeah, Mems Kosana Vele, that's our mentor right now, and her husband. So there's a gap. The words they say to us, Vele, you don't get them in like Kokasi. Yeah, and then that's what we're grateful for, Vele. Because I also don't think I would be where I am right now.
Share a little bit from where you were before the mentorship program and the differences that you're actually seeing now, now that you're in this program.
So, to be honest, like, Mina, I'm very disciplined, Vele. From the start, I have been disciplined, Vele. I would go to the thing, my brothers.
Is it self
everything.
or is it home? Discipline Dlalisa Seloma hore. This is how things are, or yourself naturally.
Naturally,
okay.
Naturally, yeah.
Okay.
So I just thing is my home situation, Vele. Also, I don't live with my parents, so at some point I had to like grow up.
Real quick.
And I had the fortune of having a younger brother. So it gave me a sense of outing. You have someone to look,
Responsibility.
to look out for. So in a way, what I do is gonna affect him. So
Of course.
everything that I do, I must calculate. Because I must lead by example. Because my brothers, I mean, I'm not proud where they are. You know, I plan on exceeding where they are. So obviously, my little brother should also exceed where I am gonna be, right? So
What was life like before the program?
before the program,
Personally.
So it was. I was disciplined, but I feel like it intensified that discipline. Yeah, because I was not really broken or lost in a way, but it intensified it. Got it, it gave us a space outing. You can be vulnerable, like such things. Yeah, besides drugs and all, you can talk to, because a lot of men do commit suicide, you know, depression, blah blah blah, and Dlalisa gave us that space, that environment. You know, it gave us a mother, a father, because they really do take care of us and they look after us. So for someone who doesn't have parents, also, as I'm saying, my parents, I don't live with my parents right now.
Did they pass?
Nah, they live go Limpopo. Yeah, so here it's just like the kids, the children.
Okay.
Yeah, but it's like you have to look out for yourself, you know, because my brothers are at work. Like everyone's just, they have their own thing going on. So yeah, if you don't have a parent, like they were there, or if someone doesn't have a parent, like you can find a sense of parenting, a father figure, a mother figure. Yeah, because they do, as she was telling you, food parcels, a bunch of things. Like, I'm very grateful for them. But I'm not talking only about me in terms of like the change they've done.
So
Other
you
people,
see it in your peers as well?
yeah, the other guys that are on the program or in the program, they were smoking. They left
Really?
alcohol. Yeah, they're disciplined. Like there's change. Like it's vivid. It's clear.
So in terms of mentorship, what is your wish or the desire that you have for Ntwana Tsakasi? And I think even yourself, because you've been mentored.
Yeah.
Obviously, this is something that you can take back to the community. What is the desire like for mentorship, Ukasi, in your view?
The most important thing I would say is to be able to open up, because I feel like that's the root of doing drugs, as you were saying. Yeah, because a lot of men don't talk about what they're going through, the depression, the stress, the anxiety. So if you talk about that, if you're able to like open up, be vulnerable, you're releasing the emotions, right? Like you're processing them in that sense, you know. So if you don't talk about them, vele, it leads to doing drugs, suicide, blah blah blah. So my wish is for boys, kokasi, to have that change in their life. They should have someone to talk to. It doesn't have to be like even your friend if you're not really comfortable with talking to your parents. But I advise you talk to your parents, because at the end of the day, that's your family and you're most safe with them. Because a friend, I mean, you'll never know what they could do with the information.
What they could divulge as well.
Yeah, just as I was saying, when you talk to someone, you're giving them the power to build you or break you.
Nice.
Right. Yeah.
Doc, I'd like to come back to you and go back to when you spoke earlier on about the psychiatric ward. That the majority were men.
Yeah.
At the time. What would be some of the things that they spoke about? The reasons as to why they're there? Was it clear? Was there a pattern that you guys could see there? And I'm coming to the issue of counseling also, perhaps with Giredi. I know in a hospital setting there should be. With Giredi as well, were they awarded that opportunity to perhaps just sit down and talk and say, Doctor, we didn't.
Yeah, and it takes some time, as Mathlatse has kind of shown us, right? It takes some time to break down that wall. You have to keep knocking.
Yeah.
So at first we get a huge defense. When a patient first comes in, so let me give you an idea, right? Patient first comes in, normally they're having psychotic
episodes.
a psychotic episode. So they normally come in involuntarily.
Okay.
So they're not they're brought in involuntarily.
Yeah.
Okay. They've either done something in the community that has shaken up the community, or they've tried to do something to themselves, or they found in the streets doing just looking aimless or whatever, right? So then they're brought in involuntarily. So then there's a huge fight. It's a big fight, okay? So the very first days, you're not speaking to them. You're trying to sedate them, and you're also trying to withdraw them from the from whatever drug that they're on. You're also trying to ascertain what the issues are, okay?
Sure.
So they won't go immediately to psychiatry at first. They start with medical. Okay, so you need to make sure that there's no medical
attend the body.
Yeah, there's no medical cause for their behavior. Okay, then once that is sorted out, then they are seen by psychology as well. It's a multidisciplinary team. Okay, so it's not just us as doctors just seeing them, because doctors normally prescribe. Okay, mental health issues actually should be dealt with mostly by your psychologists and so forth, because that is their job, to understand the brain and the mind and how it works and so forth. So then, and you also get occupational therapy. Okay, so then we sit with them and you start to speak, and as I said before, they will start very defensive.
Yeah.
And it's over time when they start to trust you, when they understand that you are not there to hurt them. You're not there to break them down. That's when they'll open up to you. We're not always fortunate with every patient. I will say to you, not every patient will get to a point where they feel safe enough to actually be very vulnerable with you. They do get to a point where they are able to be medicated and be better, but most of them, you will see them in like 2 weeks or so forth. Okay, the ones you're able to get through to, most of the things they share are social issues. So exactly what Mathlatse is talking about, the fact that you are in a child-headed home.
Yeah.
Living in a child-headed home is not easy, where you don't have the guidance, where you don't have the support. There's no food at home, and I don't know where to go. We live in a country where there's the hugest inequality that exists, right?
Yeah.
There's a lot of unemployment. So there is also that feeling of there's no hope. And Kokasi is worse. And that's something that we also need to be honest about. I remember when our family dealt with something, and my cousin had to move back to Kasi, and he said to me, he's like, Katlego, mentality ya Kasi is so different, because he used to live in the suburbs, and he's like, mentality ya Kasi is different. It's slower. People don't have, not so many people have the belief and the hope that they can do things.
Wow.
No, not that can come out of it, because you don't have to leave Kasi to
be able
create
to advance.
Yeah, you can create a beautiful life. Why not Nakasi? Look what you're doing, So it's that mentality as well, and being stuck in that, feeling like hona resolution, there's no moving forward, and nobody's coming up. No Dlalisa Moyeni is there. There's no mentor that says to you, Chomi, it's possible, or Mfanaga, it's possible. Like, this is what I do. I still live Kokasi. This is how I behave. So yeah, it's that lack of seeing possibility and hope that is very detrimental. And that's why a lot of them, and I think you will even agree with me, Mathlatse, Kokasi, a lot of men then find themselves trying to creatively express themselves. So they'll go into music, with rapping and so forth, which is good. It's really good. However, it's then, how do I then get exposure for this? How do I get money from this? And then unfortunately,
then it goes back to...
Then it's a substance. Yeah, because some of the patients I used to speak to who started the crystal meth was because they feel that crystal meth makes you more creative. That's what they would share with us. And then in terms of what Kiredi is doing in terms of counseling, we have a WhatsApp. We have a WhatsApp line that we're very proud of. We work on continuously. We have nurses on the WhatsApp line. We have a male communicator. We have a counselor as well as a social worker. And that gives the opportunity to someone who doesn't want to be visible and visibly vulnerable, the opportunity to be vulnerable.
Yes.
So we understand that we can't change that now. I can't force people to be visibly vulnerable, but at least let me give you some sort of a support where you can come in and say, where you can say, hey guys, I'm struggling with my sexuality. I'm struggling with a relationship. I'm struggling with my friends. Like, I feel that I need to have more money to chill with my friends. Or I'm struggling with exam stress. And we would love for more men and boys to actually utilize our services, because this is how we also see how we can advocate more for teenagers.
Sure.
Because we then have the opportunities to have meetings with partners and other people, and we can actually start to talk about like what programs are missing, what are the gaps, what more can we do for the young man. I mean, I didn't know the things that you were just sharing right now in terms of the initiation. That is so vital.
It is.
I don't have this opportunity every day. So we would love for more boys to join us. And can I share the number?
Sure, we'll share it. But I just want to go back to Mathlatse. I want to give him an opportunity to express or rather ask the question regarding men's health. You know, Dr. Kiyomo, and well, not necessarily divulge that you know, question, but just whatever that you would love to ask the doctor, what men go through as well, or whatever maybe to say, you know, you know. So let me give that opportunity to you.
I feel like I have a small circle, so I don't really associate with a lot of people like that. But coming from the men's side, when it comes to like testing such things, I've heard like most of the men they're afraid to like go test or go to the clinic
for whatever that it might be.
Yeah, because of the nurses or the doctors how. So I think it's something that doctors or nurses or people who work in that environment not to be judgmental, like they should be supportive when it comes to like them, because obviously that guy's gonna come there being vulnerable, and then you're not giving the support, like you're not welcoming him back for a next check. I don't know if you
so the time that you spent with the doctor, if I'm hearing you correctly, was not pleasant. You're there obviously to say utilo check. Number one, maybe they're
how they treat you. Yeah, like comments, you know, like yeah. So I think that's why men are also afraid to like test, because of the things that are gonna be said or something.
Yeah. And you guys are hearing that from each other. So have you had that experience before?
Nah.
You see,
I'm Christian.
Important.
I'm Christian, so besides like flus and you know everything, I'm good.
Okay, no, I understand what you're saying.
But that's the norm.
It could be the norm. It could be the norm.
And you also can't speak for all doctors.
Yes, I can't speak for all doctors. I do agree with you. It's called a bedside manner, right? How you treat a patient is your bedside manner. So besides everything else that you're going to do, and should there be more improvement in that? Yes, and I think it's important that we get called out for that if we are being incorrect, because you are right. It's how we behave during the consultation that will determine if a patient will ever come back to you. And the last thing you want is a patient that requires your assistance to feel that they're not comfortable and safe with you, and they decide to rather sit with their disease or illness or whatever it is because they don't feel safe. Yes, so we could work on that. But however, I also will say that, and maybe that's also something that at Get Ready we're very passionate about, so teaching agency and how to advocate for yourself.
Sure.
That you need to speak up. As soon as that happens, you need to speak up, and that person needs to be called to order, because it can't continue, you know. But I promise you, there are counselors. So especially with HIV specifically, they've done it in such a way now that normally you actually don't see the doctor or a nurse. You'll see an HIV counselor and tester, and they're normally younger. They're normally younger and much more youthful and you know, more understanding.
Have
and I
you
guess
found that actually helps the young people?
Yes.
Okay.
Even with Kiredi was very successful in that. We used to get people who'd come back, even though that was not our plan, because we were not judgmental. That was our biggest thing. No judgment, reliable and accurate information. It was the biggest thing, and we didn't speak in medical jargon. So we'd speak to you the way we are together.
And even in the way you're wearing, because
yes,
we
used to wear
tells me
t-shirts.
Yeah,
we used to wear t-shirts. We were cool. I mean, obviously you need to look professional so the person can trust you, right? But we were cool, man. We had young people in the mobile clinic who worked there, so that you can understand that we understand where you are. Because I'm also, yes, I'm a medical doctor, but I'm human. I've also been a patient before, and I would not enjoy it if I go somewhere and this person is judging me for something that I feel so vulnerable about.
Of course.
So you are correct in that.
And it defeats the purpose of why you're there.
Yeah, but I also think that, you know, there needs to be initiative. So that's not a good enough reason for you to not take care of yourself. And I'm not condoning the actions. Those actions need to be taken care of, but that's where your agency needs to come in. So you need to go in and say, I'm not going to stand for this. I'm not going to stand for this, but it doesn't mean that I'm not going to allow myself to have care because of this. And we do see that the testing in young men is less. We know that. And also this thing of testing through your partner. Please, if you can talk to your friend.
Chummy,
Don't test through your partner.
Mathlatse, another question you might have for the doctor?
I want to dive into the career, or careers in a way. So, yeah. Okay, why did you choose, like, what's the reason behind you choosing the career that you're in right now?
Well, I care about people. So specifically working where I'm working is because I've always cared about people. And I have an opportunity in some way to make whatever little impact that I can make, which is very important to me. And working with communities has been so beneficial to my growth as a human being and as a person. I have a thing that, you know, we should all have a legacy of kindness. So that's my project. And this work allows me to spread kindness in some way.
Love it.
And yeah, if we can promote kindness, because I think that's like the pillar of everything, you know?
It's the anchor.
Yeah, it's the anchor. I love that you said that way. It's the anchor. It starts there. Like when you're kind, people get drawn to you. And if you have, if God has blessed you, because I believe in God, if God has blessed you with whatever skill, He's blessed you with that skill because you are meant to do His work. You're meant to help others. So yeah, that's why I do the profession that I'm doing. And every profession that I have, Lefentse knows a little bit about me, and I have a lot of, I wear a lot of hats. I do so many things, but they've always been about people and just being kind to people. Yeah, and just growing as my own self. So whatever you do, whatever career path that you choose, it shouldn't be only about the money. Money is very necessary. It's how you live your life. It should sustain you. But I think look at the values that matter the most to you. You're Christian, you have certain values that you have. And make sure that the work that you do allows you to tap into that. And the work that you do really is for the betterment of the society. And if your society only exists for your brother, then that's fine. But what I love about you is, what I could hear is that you operate from a place of not self only, self-serving. You operate from a place where you really want to serve others. You will do fine.
Impressive. And okay, when it comes to like going back to university, right? So like how did you approach learning and academic development, like the strategies, sorry? In school,
in university. Yeah, because it's different, right? You don't have a teacher who's looking every day. Yes, discipline. You spoke about it. You have it. If you have that, you need to carry that everywhere. Motivation is not enough to push you through. Discipline is the only thing that will get you out. okay? And discipline might not look the same all the time, but if you say to yourself, I have this common goal, and every day I'm going to add something to it, you will get there, okay? Discipline within your friendships as well. So when you're in varsity, it's a beautiful place because you are now exposed to more.
Yeah.
You are not in a cage. So your identity can really, you have an opportunity to really flourish. You don't have to wear a uniform and, you know, cut your hair in a certain way. Now you can do whatever. You can have green hair. You can really explore yourself. That can be an exciting experience, but it can also be a very interesting experience, okay? Because it can expose you to certain dangers and risks. I think that your discipline also there is very important, knowing how far you go, and it should not, nothing that you do should threaten what you want to ultimately achieve. So also something else that I want to say, especially to varsity students, the friends that you keep, if a friend that you keep puts you in a position that threatens your future, that is not a friend. If your friend tells you to drink when you're supposed to be studying, that's a chore.
That's true. Yeah.
If your friend tells you, when I study, when I every day, it's already out, not a friend.
Not a friend.
If a friend exposes you to drugs, not a friend.
Sure.
Okay? If a friend is telling you that you can't do something, is validating those negative thoughts, because negative thoughts are always there, but they validate them. You say to yourself, hey, I'm hopeless at this thing, like, yeah, show me you are
You're
hopeless.
right.
At this.
Yeah,
That is not a friend. Very, very important in that. And then anchor yourself in whatever you believe in. If it's your faith, great. If you have good family standing, great. Find support, you will find people. Good people exist everywhere.
Sure.
Yeah.
They
Love
exist
it.
everywhere. Yeah, you'll be fine. But in terms of learning strategies, you have to make time for it, but you also have to make time for rest.
Yeah. And
Okay.
then with people, like, do you seek did you seek for help? Like, did you work with people or maybe certain groups when
When
you
I-
had like
When I was in varsity.
yeah,
In terms of what, like my mental health or school?
everything in general, like
In
schoolwork, your mental, because sometimes you get a setback that's like ruins everything, and you have to be strong emotionally. Like, you have to, you know, have that, you know,
A
power to
community
come
of
back.
people to
Yeah, to
help
support
you,
you.
to
around-
support you.
Yeah.
Yeah,
People
so-
that are gonna be there every time you.
Yeah, I
perform.
went through two things that really bothered me in varsity.
University.
There was a year I was dating someone. It was difficult. They didn't really like me, and it was very obvious. It
Ironic.
happens. Yeah, it happens. You can date someone who doesn't like you. And it was for me because, you know, when we're young, your relationships are a really big part of
Sure.
who you are. And I was so focused on this person, and when they were treating me horribly, I was unable to go back to my books and to really focus. And I actually failed an exam, chemistry, which really threatened my position in medicine. And if I didn't pass it, I was not going to be in medicine anymore. I got into the exam with a semester mark of 70%. I got out of that exam with less than 30%. So it didn't mean that I didn't have the knowledge. I was just
You
really
knew.
sad. I was
Yeah.
really
Yeah.
struggling.
Yeah.
And at that time, it's because I was quiet. I wasn't telling people that I was struggling. I have a good relationship with my mom, though. I will tell
Yeah.
you that. So at some point, I spoke to her, and I think the fact that she didn't judge me in that moment, and it wasn't shouting,
Yeah.
it made me feel like I'm capable of getting up. And she told me, like, you can actually do this, you know. And I did find help, and I did have students who were willing to help me through the exam and so forth, and to tutor me, right? So I felt safe then. The next one was when I was in medicine. It was my second year. Yeah, I think we do anatomy in second year. Yeah, where we get our cadavers. You guys know we get dead bodies.
Oh.
We get dead bodies to
Oh.
work
Yeah.
on. They're real human beings. My friend, my best friend of many years, passed away.
Sad.
And we were not friends at that time. We had
so
had
you
a
hadn't
fight.
spoken.
Yeah. She suddenly she was in a car accident. She passed. I couldn't focus. I couldn't even think. It was by far it was so heartbreaking. It filled my life. It filled my mind. So I didn't have space and time for studying. And once again, it was my mom and
That came through.
students. They weren't my friends, but they were students who were willing to say, okay, I'm going to help you with this. I'm going to help you with that. And yeah, and my mom always reminds me of who I am. And I think that's very important, that you have people that
Have
remind
that
you of who
person.
you are. Like, Katlego, when you're strong, Katlego, when you care about this. Because when you go through a tough time, you forget yourself.
Yeah.
Only the tough time is what resonates in your mind. So, and also prayer helped me, anchoring myself in God. And you know, that gave me the capability to, when a friend of mine, or a student I was with, she lost her mom suddenly, and it was traumatizing for her. I did her assignments for her. Sorry to the university.
Well, now we know.
Yeah, I did her
The world
assignments for her.
knows.
Because she
Yeah.
did not deserve to lose varsity just because she was going through that.
Yeah.
And I know she was capable. If she was in her right mind, she was going to be able to do those assignments. But it's because I was taught that
So
you
you
extend
were
yourself.
also that support to someone else.
Yes, and that's
Yeah.
why I say good people exist. Like,
Yeah.
good people exist. Please don't put people in boxes. Don't like look down on people. Good people exist. And in medicine, I think there's no like hierarchy. That we're not like, yeah, you're cool, you're not cool. We're all just like a bunch of people, and we decided to support each other when we could, because medicine in itself is a very hard time. But yeah, just be a kind person and you'll receive.
Absolutely love that a community. I think, are you good?
I have a last one.
Let's go.
Yeah. So this is big, especially when it comes to me also. So if ever you've had this kind of thing, is it okay to like feel somewhat frightened or scared of a career that one would want to pursue?
Yeah.
Like, is it okay?
Yeah, it's normal. I'm feeling that now. I'm in a career space that a clinical doctor would possibly be like, why are you doing that? I'm in a different sphere than what I learned for a very long time. My position is completely different to what I envision myself in. It aligns with what I truly want in my heart. And sometimes, because of society and the pressures, you can look at yourself and be like, ooh, am I making the right decision? Fear is not something that you can run away from, but you get to a point where you start to, you have to believe that what you're doing is correct. And you can't have that belief if you're not doing anything, right? I wake up and I do invest in myself in some way, and that's what actually then helps you to tackle that fear. So whatever career anybody does, you are capable to be successful in it. I don't think that, you know, there's any career that is limiting. It just depends on why you're doing it and how you're doing it. But it's very normal to be afraid of a career choice that you have. I am fearful every day, but I'm trying my hardest. And as I said, I believe in God, and that's what I trust in. And I know every day that I am doing enough to invest in it. But also, I have a mentor myself.
Wow, that's nice.
Mentors don't stop. Yeah, I have a mentor myself. I've got a coach, and she reminds me that, you know, if you're feeling this way, Katlego, because of your type personality, so I have an A-type personality. I'm a medical doctor, right? And she always says A-type personalities always need proof. We need evidence. So how you give yourself evidence is you study. Yeah.
You must walk
What
the
you don't
talk.
understand, you study.
You studied.
And that backs you up. That makes you feel a little bit more confident in yourself and your choices.
I took something today. You have a mentor. I absolutely love that.
Of course.
Superb, superb, superb.
Everyone needs someone.
Everyone needs someone. I love that, and I actually enjoyed that chat between the two of you as well, listening to you guys. But as we're wrapping it up, Doctor, I know Kiredi is in a number of provinces.
No.
Or you just in Gauteng?
So we're a digital campaign.
Digital,
So,
okay.
Yeah, so we don't have the mobile health clinics anymore.
Sure.
Yeah, so digital campaign, yes, means we're national, definitely. Yeah.
Okay. So earlier on, you wanted to give us your WhatsApp line, and I think you can do that. But I just wanted to get in also from how active it is from the WhatsApp line, whether young girls or boys, but how active is it, this WhatsApp line, and is it helping? I'm now talking in terms of solutions for young people for their health.
So for us, Get Ready is responsible for being the voice of teenagers. That's our ultimate goal, that teenagers can feel safe and can have a platform where they're able to express themselves and express their needs. Okay, so in terms of support, we're actually calling on to you as society to take on the hands of young people and actually assist them. They're trying to show you that, you know, what their needs are. So for us, yes, we're able to suggest organizations and to also link them to care. However, it's still the responsibility of that organization and that project to ensure that that actually happens, and we advocate as much as we can. So yes, our WhatsApp line is 060-019-0000, and we do see quite a few teenagers come in and they share with us, and they're very happy after, because most of the time they just want to speak to somebody. They want to hear their opinion being validated. They don't want to hear, "Ah man, your problem is not big." I think as parents we sometimes find ourselves doing that quite a lot. And they can see that we're invested in hearing, and we want to validate, and we want to give you actual practical solutions. I mean, we have professionals on it. It's not just people just lying around, right? We have a social worker, we have a counselor. So wherever we need to intervene, we definitely do intervene. And we've had situations where we've had to intervene and do things outside of the WhatsApp line. However, our capacity is our capacity, right? So actually hearing about what Dlalisa Moyeni is doing, that is something that would be beneficial to us as well, you know, in terms of a collaboration and, you know, being able to amplify the work that you're doing to get more Mathlatses on the on our line. That's very important to us. We need to hear more from teens, and they need to have their own platform. And that's what Get Ready is. It belongs to the teens. We want them to take it over. Take it.
It's yours. And just lastly, to the parents, what would you say?
Parents, what I would say is, don't put yourself before the child, and don't think you own your children. It's very important that we don't try to live our lives and, you know, vicariously through our children, and we don't try to correct our own wrongs through our children and have them carry a burden that does not belong to them. So what I mean by that is, I have an understanding that, because I am a mom, that my child came through me. She's not yours. She's not me. I have a responsibility for her, and I have a responsibility to guide her through her life as she tries to figure that out. But she's not going to live Katlego's life. She's going to live Nia's life, right? And I think that's very important. When it comes to teenagers specifically, you need to understand that they're in an area of their lives where a lot is happening, and it's not their own doing. Okay, so the brain itself physiologically is different to us. Okay, so teenagers, you know how they always talk to you about how you're not using your prefrontal cortex?
Nah.
You've never heard that?
No.
That you're not using your prefrontal lobe. Okay, they talk about it like at the age of 25 you'll start using your prefrontal cortex. Okay, so that's an area in the brain which uses logic and evidence to make decisions. You use your emotional centers in your brain to make decisions. You're not always going to make the best decisions. And that's why your parent, who's using their prefrontal cortex, who uses evidence, is there to direct. But I cannot allow you, I cannot overstep and not allow you to also experience. Okay, I'm there to guide. What does guiding mean? It means that I have to have some room for you to make a mistake, to overstep, and then we guide back. Yeah, and I think just being present and listening. A lot of the teens that we've spoken to, they just say, like, listen to me, allow me to be an individual. I'm not like my brother. I'm not like my sister. I'm not like your friend's daughter. I don't have the same passions. Listen to me, hear me out.
See me for me.
Yes, and please do not project your own issues on your children. Yes, what you're going through as a parent is a lot. It doesn't mean that the child is not going through anything as well. And I think that's some of the mistakes that we sometimes make. Listen, just honestly, like every day, if you can take 50 minutes, and just say, how was your day?
That's actually a feature that we have on the podcast. How was your week? And the young men,
Prolonged.
yeah, they say it all out. But thank you so much, Doctor. Thank you so much. We really do appreciate you. We appreciate your time. And I
Very
enjoyed
much.
this. I enjoyed this chat.
Me too. Yeah.
So much. Thank you for your time. Re a leboga. Just your last sentiments, Mahlatse?
I mean, thank you for coming and what you've shared thus far. Because, all the questions that I've asked, also it's what comes from me also, from my, what I want to know or what I'm, dealing with. So, yeah, you having to shed some light on it, it means a lot. And, yeah, hopefully I can grow from that. Yeah, thank you.
Re a leboga, Chomi.
Thank you, Chomi. And thank you, Mathlatse, you're the best.
Ladies and gents, thank you so much. Please do remember to like and to subscribe and to put on that notification bell every time we upload a new episode. It comes on every Friday. We should be here right in front of you guys and tackling issues about young boy children, about men and everything that they go through. Remember, there is a safe space. There is a place to go to. You don't have to die in silence. But until then, we will see you guys next week. Have a great one.